Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. We're going to talk about the medication paroxetine. We're going to talk about the uses, dosage, side effects, potential for weight gain and withdrawal with the medication paroxetine. Specifically, as we go through this video, it'll be what is paroxetine. I'm going to talk the uses, dosage, the most common side effects. We'll talk about some of the other side effects, warnings and cautions with paroxetine. Talk about the potential for weight gain, and then we'll discuss withdrawal symptoms as well with this medication. As with all my videos, this is informational purposes only, not intended to serve as a substitute for your healthcare provider. So what is paroxetine? It's in a family of medications known as SSRIs, or selective serotonin reuptake inhibitors. They're a family of antidepressant medications, increase the amount of serotonin available in the synapse. To help with the symptoms of depression. In the US, it's sold under the brand name Paxil. There are a few different tablet formations available. The IR, or immediate release tablets, those are available in 10, 20, 30, and 40 milligram tablets. The ER, or extended release tablets, those are available in 12.5, 25, and 37.5 milligram tablets. What are the uses? It's approved for use in anxiety disorders, depression, OCD or obsessive compulsive disorder. It's approved for panic disorder, PTSD or post-traumatic stress disorder, premenstrual dysphoric disorder, social anxiety, and symptoms of menopause. There are some off-label uses. Some of those are body dysmorphic disorder and premature ejaculation. There may be other conditions that your doctor feels this is appropriate medication for, and they may use it what is called off-label. Off-label simply means that there were no large-scale studies for that, but we have found that it does seem to help those conditions. What is the regular dosage? It's going to vary, of course, by the condition, but typically when started on the immediate release tablets, folks are started on 10 to 20 milligrams, taken once a day. Extended release generally in the 12.5 to 25 milligram range. Max dose tends to be 60 milligrams of the immediate release, and the ER somewhere around 75 milligrams. That typically folks don't get up to that higher dosing. It is generally taken in the morning and with or without food. Exception would be when taken for symptoms of menopause. That's typically going to be taken at bedtime. Most common side effects, drowsiness. Now, keep in mind all these side effects, they're dose dependent. So the lower dose that you're on, the less likely you will have these. And many times, the longer you're on the medication, the side effects improve. But always be sure to speak to your healthcare provider if the side effects are bothersome to you. Drowsiness can occur in up to a quarter of people who use this medicine. Insomnia or difficulty sleeping, again, up to 1 in 4. Headache can occur anywhere between 6 to 18%. Dizziness in that 6 to 14% category. Diaphoresis, excessive sweating, 5 to 14%. Nausea, again, in up to a quarter of people who take that. Other common side effects can include dry mouth, constipation, diarrhea, ejaculation disorder, tremor, and weakness. And again, many times these will improve, but always talk to your healthcare provider if you find them too bothersome. Other side effects, not as common, but can occur: anxiety, bleeding issues, impotence, loss of appetite, rash, decreased libido, vomiting, difficulty breathing, palpitations or heart racing, fatigue, confusion, weight gain, stomach upset, muscle pain, back pain, and then there are others that tend to fall into the 1% or less category. Well, some of the warnings, as with all antidepressants, we need to warn for the potential for suicidal thinking and or behavior. Extremely rare, but the potential is there. So if you feel your mood is going in the wrong direction, please seek help from a healthcare provider. Mania, people with bipolar, this may push them too far from depression into mania. Serotonin syndrome can occur. We'll talk about that just a touch more in the next slide or two. Vision changes, any changes in vision, you'd want to be sure to have that checked out. Seizure risk seems to be folks who've maybe abused alcohol in the past are at a higher risk, and people who have had seizures in the past, also at a higher risk. Otherwise, most folks would be at a very low risk of seizures with this. Bleeding risk, we'll also talk a little bit more about that. And drug interactions, it is best to always get your medications filled at the same pharmacy. Make sure all your doctors know all your medicines that you're on. That allows your healthcare team to screen for drug interactions, but we're going to go over some of the more common or serious ones. The ones we want to talk about, antiplatelet and NSAIDs. NSAIDs are anti-inflammatories like ibuprofen, Motrin, Aleve, naproxen, Mobic, meloxicam. All those can have a risk already of bleeding, and taking it with SSRIs like paroxetine can increase the risk of bleeding as well. Antiplatelet, so anything that you take to prevent blood clotting, those put you at a higher risk of bleeding, and so the two together can increase that risk of bleeding even more. Usually they may be used cautiously. Of course, you want to make sure your doctor is aware of that, and always watch for side effects of bleeding. Triptan, tramadol, opioids, dextroamphetamine. These put you at a risk of what's called serotonin syndrome. They can slow the clearance of serotonin, and that increases the risk. Serotonin syndrome is very serious, but it's very rare. It's like you get like real agitated, you can't settle down, you can even have hallucinations, your muscles, you can have tremor, rigidness, increase in heart rate, excessive sweating, seizures. This is a condition, like I said, that's very rare, but that you would need to seek immediate medical attention. Other drug interactions are also possible. Again, that's why you want to go to the same pharmacy, let your doctors know so they can screen for those. Just wanted to go over the ones that we worry about the most. Weight gain. Unfortunately, weight gain can occur with paroxetine. Does seem to be dose dependent. So being on the lower end of dosing can mitigate the risk of some of that. Seems like SSRIs may increase carbohydrate cravings and just can increase appetite in general. Significant weight gain can occur, again, dose dependent, in up to 1 in 4 people taking that. Some studies have shown a 6-pound or about 2.5 kilogram gain over 3 months. So it's something to keep in mind. A lot of the other SSRIs are not associated with this amount of weight gain. So if you do have some weight gain occur, there are some other options out there. Just make sure you speak to your healthcare provider so they can kind of determine what medication you could switch to, or if there are other things you could do to offset that weight gain. Withdrawal. If you have been on the paroxetine longer than 3 weeks, it's typically recommended that your dose be tapered. And that taper generally occurs over 2 to 4 weeks. Again, that depends on how high your dose was, how long you've been on it, and how you tolerate it. Some people may need a longer taper. Some people can get by with a shorter taper, simply based on your symptoms, how you feel as you're coming down off that medication. I do appreciate you watching this. If you like videos like this, I'd appreciate it if you'd like this one and subscribe to my channel. Go ahead and ask any questions in the comments below. I will do my best to answer them. I thank you for watching.